Good morning, according to Pakistan time. I'm Sayyida Tasneem Kausar and highly delighted to present my research presentation, The Impact of Virtual Reality Simulation of Developing Advanced Clinical Reasoning Skills in Nursing Students. First of all, the outline, introduction, problem statement, objective, literature review, research methodology, results, discussion, and conclusion. I will provide brief introduction about this presentation. Virtual reality simulation has emerged a powerful educational tool in nursing education, significantly enhancing students' ability to develop advanced clinical reasoning skills. Unlike traditional learning method, virtual reality provides immersive interactive scenario that closely replicate real life clinical environment. This level of realism enables students to practice assessment, make clinical judgment, and respond to the complex patient situation in a safe, controlled setting. Moreover, during time of realistic clinical placement, such as pandemic or hospital shortage, virtual reality offers a viable alternative or experiential learning. It ensures continuity in skill development and help building students' confidence before entering to the actual clinical environment. As the healthcare landscape becomes increasingly complex, the ability to simulate high-stakes, diverse clinical scenarios through virtual reality become invaluable in preparing nursing students to deliver safe, effective patient care. Now, the problem statement. There is a growing need for innovative educational strategies that can bridge the gap between classroom learning and clinical practice. Virtual reality simulation offers an immersive experiential learning that may enhance clinical reasoning by enabling students to practice decision making, prioritize patient care. However, the extent to which virtual reality simulate effectively support the development of advanced clinical reasoning skill in nursing students remains explored. The objective to examine the role of virtual reality simulation in enhancing nursing students' ability to evaluate, analyze, and respond effectively to complex patient care situations and comparison to traditional teaching method. The literature review, according to Lieb and Beek, 2024, his study was COSAI Experimental Development of Virtual Reality Simulation Program for Adult Nursing. His sample size was 52. The student using virtual reality showed significant gain in clinical reasoning, knowledge, and confidence through immersive scenarios. According to Sanli Hai Kyongson 2023, COSAI Experimental Pre-test and post-test. His sample size was 76. Nursing student neurological examination, virtual reality problem-based learning. The key finding was virtual reality significantly improved knowledge, clinical performance, self-efficacy, and reasoning skill related to neurological assessment. The research methodology which I used was mixed methods and use sample size final year bachelor nursing students who participate in virtual reality simulations. The intervention consists of virtual reality simulation scenario depicted high-risk clinical situation. The intervention were in the form of virtual reality simulation scenario showing clinically practical and high-risk situations. Then data was collected pre and post-test, validated clinical reasoning. And the instrument of data collection was the study employed to the mixed method approaches, pre and post-test, validated clinical reasoning rubric, semi-structured interview, and focus group. Focus group will also be used to capture the opinion of students about virtual reality as a tool in learning. And in data analysis, statistical tests will be performed on quantitative data, for example, paired t-tests and ANOVA. Thematic analysis. Thematic analysis should apply the qualitative information to detect the most salient pattern in the experiences of the students. And the result was nursing students showed statistical significant improvement in clinical reasoning skill after virtual reality simulation. The p-value was 0.5. Pre-post-test score indicate enhanced skill in recognizing important clues, analyze patient information, prioritize intervention. Clinical reasoning rubric scored improvement was 68 to 85%, suggesting virtual reality effectiveness in fostering advanced thinking skills. The results suggest virtual reality's potential to improve cognitive competencies beyond procedural skills. Students recall the virtual reality presented more animated, interactive, and realistic situation, and they became more related to the theory and practice shift. Students found virtual reality to be more engaging and realistic, building the theory-practice gap. Compared to traditional instructions, the virtual reality group outperformed the control group in clinical reasoning skills. The discussion was that study finding align with Cobb's experiential learning cycle and Tanner's clinical judgment model, explaining the improvement in students' clinical reasoning ability. The results put previous students on virtual reality impact on confidence and procedural competencies, while also demonstrating its effectiveness in developing higher order reasoning skills. Implementing virtual reality in nursing curricula could help address clinical placement shortage and better prepare students for complex patient cases. Moreover, virtual reality simulation positively impact nursing students' clinical reasoning, confidence, and reflective practice. Nursing educators should consider integrating virtual reality into curricula to provide realistic, immersive experiences and bridge the gap between theory and practice. Furthermore, research is needed to increase generalizability, examine long-term clinical performance, and identify best practice for virtual reality implementation in nursing education. Now, the strength, limitation, future direction. The study's strength include its mixed method approach, providing a comprehensive understanding for virtual reality's impact. However, limitations include a small sample size and single site setting, affecting generalizability. Further research is needed to explore virtual reality effectiveness across nursing curricula and its long-term impact on clinical skills. Despite this, the studies spotted the practical of virtual reality as a valuable teaching method in nursing education. These are the references of this presentation. Any question from your side? And thank you so much.